Is Tylenol really the cause of autism, or is it just a misinformed statement from the Trump administration? Hi, I'm Paula Bermeo, clinical psychologist, and on this channel we talk about various topics and we analyze them from a psychological point of view. So if you're interested, please keep on watching. Before starting this video, I want to remind you that I give in-person and online therapy, so if you need a consultation, please feel free to reach me out on my social media, my phone number, my email. All of them will be listed down below on the description box as well. Don't forget to like this video, subscribe to the channel, it will help me out a lot, and also don't forget to leave your opinion on this specific topic in the comments down below.
Effective immediately, the FDA will be notifying physicians that the use of let's see how we say that, acetaminophen, is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
It might be a bit late to talk about this topic as it happened at the end of September. Back then, it stirred up a huge debate, a massive controversy at the moment, but as fast as the reactions were, so the discussions died down because it's the internet and everything moves way too fast. Still, I don't just want to ignore this conversation because it's still about mental health. It's still about possible myths around it, which I, as a mental health provider myself, feel the responsibility to confirm or debunk because of my ethics. Because I acknowledge when it comes to my field, there is a lot of misinformation that has been widely spread, but at the same time, there is a lot of truth that people tag as bogus and choose to ignore it because they are in denial, because of their own biases, because of their lack of objectivity, because it doesn't necessarily benefit them. I'm a psychologist who comes from a neutral perspective, so I can actually inform, so I can give you the facts and you can actually take care of your psychological well-being. With that said, is it true that Tylenol causes autism or not? Before diving in, I just want to give a few disclaimers. First, this is not a do not take Tylenol message, always consult with your doctor. Second, do not use this video to diagnose anyone with autism. This is educational content. Third, this topic is very complex. It involves basic psychology but also neuropsychology, which is very scientific, so I'm going to try to oversimplify it. Tylenol and autism for dummies, as kids say these days. Basically, with that out of the way, what is autism to begin with? Autism spectrum disorder is a mental difficulty related to the brain development characterized by persistent deficits in social communication and social interactions across multiple contexts, meaning that there is a lack of emotional reciprocity, hence why the individual may find it difficult to maintain a conversation. They may not even reply to anyone to begin with. They may not show emotions nor affection towards anything, towards anyone, and they don't find common interests with others. There is a lack of non-verbal communication as well, hence why they tend to not make eye contact, could not make gestures. They do not understand the use of them. They don't differentiate different voice tones. They may also not know how to speak according to certain situations. They could be talking loudly in a classroom or may interrupt others, take things way too literally as a joke or a metaphor, for example, and these social skill issues may explain why they have a hard time adapting to social contexts in general. Restricted, repetitive patterns of behavior, interest, or activity, which could be manifested in stereotyped or repetitive movements, as when they play with the same toy over and over and over again, lining objects, being fixated with a specific routine and having a hard time adapting to even the most minimal changes. That's why they could also salute others in the same way, for example. This is why they are fixated and are are highly restrictive about their own interests, as in they like to play on their own because they love cars so much they have to play with them every single day, not as their peers that may want to play to something different. They are also so into cars that they try to search for every single fact about cars and know everything about them. This limited range of interests could be a burden in their social life, as they won't share a significant interest with others, so they find it difficult to bond with people at work, in a future, in academic environments too, because if they are not interested, they most likely won't touch their school books, nor they'll do their assigned tasks. This restriction is also why we could find them being hyper or hyporeactive to different stimulus, hence why they may have sensory issues and want to eat the same food, for example, the one they already know, or on the other hand, they don't feel pain at all, not even when they get severely injured. But yes, that's autism according to manuals, and I need to add that it's usually not detected during someone's first life stages, as often parents may think the kid doesn't make eye contact, gestures because they could be blind, or doesn't turn when they call their name because they could be deaf, and they look for help for those issues before even suspecting it could be autism. Or on the other hand, if they don't acknowledge those early signs, which happens very often because of the lack of education about them, it's also usual for parents to seek help when kids are between the ages 2 to 5, when certain autism behaviors become more noticeable. Nonetheless, sometimes it can be confused and mixed up with ADHD due to common symptoms as interrupting in conversations, being aggressive, their difficulty to focus, and it can even be undiagnosed until adulthood, making it difficult for the individual to receive inadequate treatment. But anyway, as I just said, that's the textbook definition of autism. But what does neuropsychology tell us about it? Autism is one of the most researched mental disorders in neuropsychology due to its complexity. It's been necessary to study how the autistic brain works to try to find its root causes, to prevent or reduce its prevalence, to try to comprehend why people with this disorder act in a certain way, the ways in which they perceive the world, if there are synaptic connections, hormones, more or less active loads that influence on it, to simultaneously be able to create useful psychological and even psychiatric treatments that can help this type of patients to ease their discomfort. So what does this research tell us about autism? First, investigators have found that in autism there is a bigger symmetry between the left and right hemispheres, meaning that the structure and functions of the brain are affected. If both hemispheres are about the same size, the development of the different abilities and skills of the different brain lobes and its respective tasks gets sort of complicated, as it is more difficult for one area to develop and grow more than the other if every part keeps growing at the same time. That's why they may present language delay, more impulsiveness, less empathy. Keep in mind that brain asymmetry is completely normal and actually healthy. That's why some people are better leaders, better musicians, mathematicians, football players, drawers, more altruistic, more logical, etc. It all comes down to an individualized brain development that causes those hemispheres differences. On the same page, research has found that autistic people have 17% lower synaptic density across the brain than the average person, meaning that there is a lack of communication between neurons, a less active nervous system, therefore they are less receptive, which explains their poor understanding of social cues, reduced eye contact, pain tolerance, and more. This poor neuronal connection could cause hormonal imbalances as well, reason why patients with autism could have a more changing cortisol rhythm, but also, and very crucial, that's why many of them have elevated androgen levels. Androgens are hormones that promote the development of male sexual characteristics, which include testosterone and dihydroepiandrosterone, which I'll refer to as DEAS from now on because it's way way too long. And curiously, both of them, testosterone and DAS, are related to emotional and mood regulation and energy regulation, which we know is very valuable in autistic people. But why? An excessive amount of androgens causes an imbalance in GABA, gamma aminobutyric acid. It makes it increase significantly. GABA is a neurotransmitter that has a calming effect, but when it is excessive, it kind of numbs you out. It shuts the nervous system down, making you less receptive to stimulus. It causes motricity and language difficulties. It inhibits normal brain activity, which we know is common in autistic spectrum disorders. Now, those imbalances could be caused by both environmental and biological conditions. As parental age, the older the parents are, the bigger chance of autism there is. Maternal diabetes, prenatal exposure to air pollutants, heavy metals, premature birth, birth complications or low weight at birth, and last and actually very relevant regarding this topic, an excessive presence of androgens in the mother can affect the baby's brain development, which could be caused for previous conditions as PCOS, insulin resistance, obesity, and more that include the consumption of certain medications during pregnancy, as we'll see in a minute. Remember that the baby is on the uterus. The uterus has a placenta that covers the baby that is connected to the umbilical cord. So the baby can receive oxygen, nutrients, they can remove waste, but also this placenta makes it possible for the mom and the fetus to exchange different substances, including androgens, which if they are excessive in the mother, well, there is a huge possibility of the child getting that excessive amount of androgens too. Therefore, a huge chance of developing autism as well, because I remind you, in autism, there is a higher level of androgens that promote the rise of GABA, both things being potential indicators of autistic disorders. But why has Tylenol been accused of causing autism? I needed to talk about this whole shebang first so we can get the full neurological picture, but I also need to talk about other meds that have been linked to autism before, because if we see why they've been related to it, we might understand why could Tylenol also be a potential trigger of autism. Throughout the years, research has told us that taking certain medications as valproate and carbamazepine during pregnancy could increase the risk of developing autism. Valproate and carbamazepine are both analgesics used for seizures, for epilepsy too, as they serve as GABA enhancers to calm the nervous system down, to numb the pain. Yes, they increase GABA that we already know is excessive in autistic patients. If taken during pregnancy, we first know these meds can get to the baby through the placenta, but also remember they sort of numb the system, meaning that they can put detoxifying mechanisms in the body as the liver in a slippery slope. In simpler terms, it could be difficult for the body to detox from excess, including GABA excess, potentially affecting the fetus with those leftover toxins that haven't left the mother system, accumulating way too much GABA in the placenta, which could trigger a surplus of androgens as well, excessive androgens and GABA that autistic individuals have. That is why scientists have determined that consuming those two meds during pregnancy could cause autism, as they have actually seen a common pattern of moms of autistic children that have consumed valproate and carbamazepine during pregnancy. But this has awakened curiosity about if other meds that are often consumed during pregnancy are safe, or they too could have components that could enhance the chances of developing autism, as Tylenol. I do gotta say that it is not nuts to doubt about other heavily consumed meds as potential triggers for autism, but why acetaminophen, better known as Tylenol? It's a painkiller as valproate and carbamazepine, so it too increases GABA that numbs the system, but not only that, acetaminophen in the body has a reaction called sulfation that, if happens during pregnancy, converts converts adrenal androgens and estrogens to DHEAs, those androgens that are very present in autistic individuals. So it is possible that if taken excessively, Tylenol could increase GABA and androgen levels significantly, which is a risk factor for autism. And just as valproate and carbamazepine, researchers have seen that there is a common pattern of mothers of autistic children that have consumed Tylenol often during pregnancy, so there could be a huge chance. Of course, correlation does not equal causation, but if there are some red flags, the best thing is to prevent over-consuming this medication, to take it in moderation or try to avoid it as much as possible and consume it if it's really necessary. I'm not demonizing Tylenol though, but I have some reasons. First, it's still a topic of investigation, and in the meantime, I would say that moderation is the way until this is actually proven otherwise. Also, autism research, including its link to certain medications, has been mostly done on boys, hence why the emphasis on androgens, meaning that we still don't know if Tylenol, valproate, or carbamazepine could be related to autism in girls. Nonetheless, considering the rise on GABA levels, there is a slight chance they could go hand in hand. Still, I reiterate, there is a lot of blanks in female autism that would be important to fill in. And I also acknowledge that it might not be 100% possible for pregnant women to stop consuming Tylenol, as it literally is one of the few, if not the only, safer medication that's been available for them to take while dealing with plenty of things generated by pregnancy on itself. Remember, just try to be moderate with it. And just because we're talking about balance, I also want to point something concerning out. I understand that you don't like certain politicians, that's fine, but it's worrying to see people getting blinded by the spies to the point that they are willing to risk their own and their babies' lives just to fight someone that has a different political perspective to them. If you don't know what I'm talking about, well, after Donald Trump said Tylenol causes autism, left-leaning people in general, not only women, started to say he's not a doctor, so we shouldn't listen to him. We should only listen to those qualified doctors. And many left-leaning doctors were like, yeah, listen to us, Tylenol is not dangerous, take it, which by the way is unethical. They shouldn't have encouraged these people, but rather warn them about other potential side effects, not only on pregnancy. And this triggered a dangerous trend in which left-leaning pregnant women were showing their obviously pregnant bellies, and right after that, well, they chogged on Tylenol pills just like that to show that they don't do anything and prove Trump wrong. They acted so impulsively due to their closed, square mindset that they forgot that any medication, including Tylenol, if taken in excessive doses, is risky for anyone's health. That's why there are guidelines and those recommendations written in the box, because maybe if you take too little, they won't be as effective, but if you take way too much of them, they could affect your health significantly. Hate won so much, hence why allegedly some pregnant women were even taken to the ER after filming those TikToks. I mean, if your despise gets to that level of impulsiveness, I think you may need mental health aid, because it's dysfunctional that you are willing to risk everything, even your kid's life, to humiliate someone else. But not only that, their cognitive biases and selective abstraction made them forget that openly woke universities as Harvard and Yale have actually been saying that Tylenol could trigger autism for some time already. The experts they claim to trust in so much have raised awareness about the same exact thing Trump said, but because Trump said it, now it's bogus bogus. That's contradicting, that's hypocritical, that's textbook cognitive dissonance, because if you truly relied on those educated people that now have agreed with Donald Trump, if you were firm with your ideas, it would actually be a victory moment for you all. What I mean by that is that they are so blinded by their own political beliefs that they cannot see things with objectiveness, so much so that they prefer to contradict someone they hate, ignoring that their own people have said the same thing, which only exposes how of a dysfunctional behavior these people have, which simultaneously weakens their entire ideology, as their actions demonstrate that they don't really believe on what they preach all the time. And they forgot that the president has a team of experts he works with to make sure every area in the country works optimally, and then he transmits what the experts told him. If he's saying, hey, Tylenol causes autism, it's because the experts he works with in the health field told him, we found this, here's the proof. You know, it's not because he's just throwing random words to the wind. With that said, I can conclude that there is a chance that Tylenol could cause autism. Sure, there's a lot to investigate yet, as this is a recent finding, but if there are red flags, the best thing you could do if you're a pregnant lady that really wants to protect their baby is to take this whole thing into consideration and try to moderate the amount of Tylenol you are consuming as a prevention mechanism. Again, I know it is difficult to avoid it completely, especially if we don't know which other meds are safe for you, but in the meantime, be mindful with how much of acetaminophen you are taking in pro of your baby's well-being. Is there something you learned from this video or something that you would like to add to the conversation? Leave it on the comments down below. Also, don't forget to like this video and share it with someone that may find this useful, and don't forget to subscribe to the channel so that you never miss out on more interesting psychology content. Thanks for watching.